Hey, good morning and good afternoon, depending on where you are in the country. This is Bianca Frogner. I'm part of the leadership committee for the Award Network, the Advancing Workforce Analysis and Research for Dementia Network. I'm so glad to see folks joining this today for our wonderful webinar titled Policy vis-a-vis Programs, Insider Perspectives on Improving Care for Older Adults with Jenny Chin Hansen and Robin Stone. But before I introduce them, as usual, just want to go through a little bit of housekeeping. And again, this webinar is recorded, so we always welcome you all to share these videos after the fact or go back and look at our old videos. And where on our website, you can find what's coming up next. And so just to highlight that, next month on August 7th, we'll be back to our first Wednesday model where we will be having a presentation about video delivered dementia, home safety, and caregiving support. So highlighting some of the technology improvements to help improve care for people living with dementia. We are always welcoming ideas for future webinars, and you can scan that QR code there and share that with us with a very a short survey that is at the top of that website, but also that's where you can find all of our prior recordings and future webinars and register for those. And I also want to thank, as always, our wonderful webinar committee members. It really takes a team to get these up and going and organized. So I do want to acknowledge a wonderful team of folks who are engaged in this way. And if anyone has an interest in joining the webinar committee or being more involved in the award network, we certainly welcome folks to email me, email Joanne Spetz, email Kat Calder, who's the assistant for the award network, email any of us, and we're happy to get you more engaged in our network. Also, I want to acknowledge our wonderful leadership committee. Many of you had a chance to meet some of us in person last week at the Academy Health annual research meeting in Baltimore. So it was wonderful seeing some of you all there. We're excited to also get to see some of you and get to know some of you next week during the first Summer Institute for the Award Network. We've also been hearing from our pilot awardees. And so we know many of you are being engaged in the award network in many different ways. And hopefully there'll be more opportunities for you all to be involved with us in the future. And with that, I also want to acknowledge the National Institute on Aging for supporting this webinar series and all the activities of the award network. So with that, I'm going to take my slides down and stop sharing my screen. And I'm going to introduce our two wonderful speakers who I'm going to ask to go ahead and turn on their videos at this time. So I'm very excited to have these two wonderful women who I've had the great pleasure of chatting with over the last few months in preparation for today's presentation. I've also known Robin Stone for quite a while, but Robin Stone and Jenny Chin Hansen are both on the advisory board of the award network. So we're also very grateful for them to give their time to this award network in those ways. I'm going to give a brief history about both of their backgrounds, but we'll certainly have more of it revealed as we have our conversation today. And they both have long and impressive histories, so it's hard for me to really capture that all in a bio, but I will do my best. So Jenny Chin Hansen is the immediate past CEO, of the American Geriatric Society. Earlier in her career, she was also the president of AARP, which she held during the development of the Affordable Care Act. We'll be talking more about Unlock Inc., a nonprofit family of organizations providing comprehensive medical and community-based services to older adults in San Francisco, where she's had a long career with them, and we'll hear more about her experiences there. But prior positions that she has held include a 6-year term as a federal commissioner of MedPAC, or the Medicare Payment Advisory Commission. She also served on the National Veterans Health Administration Advisory Committee on Gerontology and Geriatrics. And there are so many other roles that she has held, as well as being honored for things such as receiving a CMS Administrator's Award of Achievement and the Picker Award for Excellence and Advancement of Patient-Centered Care in Long-Term Care. So undoubtedly, as you can hear, she has a wonderful background and very well, lots of knowledge about how to provide great care for older adults in the US. And so I'm going to turn to Robin Stone. Is the current Senior Vice President of Research at Leading Age and the co-director of Leading Age Long-Term Services and Support Center at University of Massachusetts in Boston. Um, and many of you are probably familiar with Leading Age, and we'll certainly talk a little bit more about that too as we have our conversation today. But prior to there, she was at the International Longevity Center USA in New York City, where she was the executive director and the chief operating officer there. She also previously worked for the Federal Agency for Healthcare Policy and Research, otherwise known now as ARC. And so we'll talk about that experience that she had in the federal government there. She also served in the White House as the Deputy Assistant Secretary for Disability, Aging, and Long-Term Care Policy, and was the Acting Assistant Secretary for Aging in the U.S. Department of Health and Human Services under the Clinton administration. I certainly have admired Robin's work and have certainly admired just all the things that she's done over the years. So it is such a pleasure for me to have this conversation with her and with you all too. So I'm going to start off by asking Robin and Jenny some questions that will hopefully just really lead to a conversation. And we do want to turn the conversation to you all and have you all chime in with your own questions. There is the Q&A function that should be at the bottom of your screen. So go ahead and enter questions there. I will monitor that along the way. If it seems like the questions are on the current topic at the moment, I'll integrate those questions during our conversation. Otherwise, we'll certainly save some time here at the end for a conversation with you all and engage you all. So with that, we'll go ahead and start the conversation. Thank you so much, Jenny and Robin, for joining us today.
Great.
So I'm going to kick us off by asking Jenny to maybe give us a little bit more background about the Unlock program and specifically the PACE program, because many folks here are probably familiar with PACE, but they're probably not familiar with some of the origins of PACE. But specifically, as you talk about that, we would love to hear how you got started with them and how your role evolved over time since you were there for about 25 years, if I saw that right.
That's right. Yeah. Well, thanks, Bianca. And uh, I appreciate the pre-conversations that the three of us have had. Poor Bianca had to kind of keep the lid on us. So hopefully we'll behave, Robin, today. And
No problem.
Robin and I go far back, which will be part of this story as well. Well, if you can believe it, I actually joined Unlock 43 years ago. And I did spend just about full 25 years there. And the basic core origin story of Unlock was during that people's life cycle, people need long-term services and supports, as we call it now. But when you think about in nearly 50 years ago, that alternative was the nursing home. And so, as it turns out, as some of the people from our community, which was the northeast section of San Francisco, and that neighborhood was called the Chinatown North Beach area and comprised of probably three major ethnic racial groups. That would be Chinese elders, Italian elders who spoke only Italian, and Filipino elders. And so when they reached the point where people found themselves needing this bevy of services that were important for thriving, there were no nursing home slots available in the city, and especially for people who would be on Medicaid or Medi-Cal, as we call it. So the search was on to see whether or not we could afford to build a nursing home in this quadrant of San Francisco. And even then, we're talking about over 50 years ago, the cost was unaffordable. But the reality is people needed services, and if they did get a nursing home bed, it oftentimes was anywhere from 20 to 30 miles away. So everything that they knew was lost at a time of greatest vulnerability. And then when you add language and culture to it, the compounding of that last period of people's lives was just unacceptable. And so that's where the search began and the circumstance of connecting internationally. It was a geriatrician from from Oxford, England, who happened to come across the path of our founders. And he said, don't build a nursing home. You do what we do in the UK, and we have day hospitals. This is where people come during the day and they have a chance to get some services, but then they go home and sleep in their own beds. And so that was the genesis for us to start the experimentation of becoming what we now know to be the Adult Day Health Center. So that actually, the genesis there was really the day hospital in the UK. And so, long and the short of it, as we tried these services and some supportive services like housekeeping at home and all, needless to say, the services became of greater need and of greater professionalism until it was seen with a sentinel story that somebody was cared for the team during the day, Monday through Friday. And on the weekend, he ended up going into the county hospital. And once he went into the county hospital, we totally lost him. And that was when it was recognized, boy, we really need to make sure the system, surrounds the individual. And we had not included medical at that time. So medical services were introduced into this. So it was a jerry-rigged process that led to a more systematic aspect that we can talk about later. But that was where the research and some of the work was as we accrued these services and got a stronger sense of what it is. In essence, PACE becomes a virtual nursing home in the community. And that effort started probably close to 50 years ago.
And tell me, Jenny, you started off, I believe, as a researcher. Is that how did you find your way into it? Because you certainly
Right.
climbed the ranks through the program, but I know you started off with a very specific set of skills you were seeking when you joined.
True. I was lucky, just as this program is funded by the National Institute on Aging. There was a federal government program called the Administration on Aging, which is more geared for social-based services. They had a talent, a skill development segment to help build the workforce. So this is appropriate when we think about this being a workforce program to help minority individuals who were not researchers begin to develop some research skills. So I start on the baseline as a nurse. So I come from a more clinical perspective, and it was to learn some research methods. And so I had a chance then to be placed to given an option to go to San Francisco because I was teaching in the School of Nursing in San Diego at the time. So I had a leave of absence, came to Unlock as a research assistant and learned research and did some of the research interviews that were part of what helped, the research knowledge build at Unlock. So from there, then they offered my grant was over with, and they offered me a chance to stay, and so I did, and then moved into operations and administration, and then eventually, when the founder retired when she was 65, I became the executive director, CEO.
Wow, what an amazing story. And I know there's a lot kind of in that process, but it really speaks to the importance of investing in researchers in this area because look at where it could lead. And that's part of this conversation today is to learn a little bit about these programs, but it's all to set the stage for really understanding the careers of Jenny and Robin, because I think you all in the audience will probably see yourself in some of the stories, but also see opportunities and parallels about kind of where we are today versus kind of what's been happening in the past. So I'll turn to Robin. Tell us a little bit about Leading Age. A lot of folks in the room know about Leading Age, but also sharing your role too in research and how you got to where you are today.
Sure. Well, I also have a somewhat circuitous route. I set my career in two quarter centuries, just like Jenny. So 25 years in policy work and 25 years at Leading Age. And so I guess I should probably start from the beginning, which is way back about 47 years ago. When I was really trained in policy, Policy and aging. I've always been interested in aging from a child, and I was raised by a single mother and two grandparents that were essential in my growing up. And so it was always important to me. Furthermore, I was very interested in disparities. Believe it or not, that was an issue 50 years ago. And the biggest disparity 50 years ago was older adults were the poorest population in the United States. 33% of older adults in the late 60s and early 70s lived below the poverty line. So I went into aging policy for those two reasons: care for older adults and addressing some of the poverty and health disparity and economic disparity issues, particularly for older women. So in those days, in the early 70s, there was something called the Presidential Management Internship Program. It was a new program. And those who were coming out of master's degree programs had an opportunity to apply. And what was exciting about it, it fast-tracked you into the federal government. So I love that program. That's literally how I started my career. After about a year at AARP in 1975, when it was a mere 12 million members, I went into this PMI program and went to what is now ACL, the Administration on Community Living, but at that time was the Administration on Aging within the Office of Human Development Services. And that's really where I did my presidential management internship work. That I was so committed to civil service. And you know, the notion that right now we're in a time when we're looking at the federal government in very different ways. This was a building time years ago in terms of really strengthening the expertise and knowledge in the federal government. And it was fabulous to be a part of that first cohort of the PMI, some of whom are still my very good friends to this day. But I still hadn't completed what I wanted in my educational career. So after the internship program, I actually went back and got my doctorate in public health at UC Berkeley. And I did spend 6 years out at UC Berkeley and UCSF. I worked at UCSF and went to school at UC Berkeley and actually finished my dissertation through an AARP dissertation grant at UCSF. And in those days, we had a center on aging that was funded by the Administration on Aging. And I think one of the things that's really important for people to know, not that we're oldies now, but that there was a history of a gerontological and geriatric research that has evolved, but in many ways is also iterative. And there was a lot to learn in those early days, going back to the Unlock program that Jenny was talking about. That was the preeminent seminal piece of modeling around a model that actually integrated services at the community-based level for older adults with challenges, both medically and social determinants of health. And I think it's really important to understand sort of the history and the evolution of those types of models for where we are today. So fast forward very quickly, I went through a whole set of jobs after I came back from finishing my doctorate, went back to Washington, started in working in the federal government as an intramural researcher in what is now AHRQ. So I actually had great opportunity to use secondary databases that nobody else could use in those times because they weren't public use in those days. They now are, but they were not. But I also had a policy itch. And so I ended up going to work for the White House on two commissions, the Pepper Commission in 1989, which was the first one that looked at healthcare reform that included long-term care in it as part of the reform effort. And secondly, the Clinton Healthcare Task Force in 92, which was another effort to get long-term care financing as part of a larger healthcare reform effort. Both of those died, but they were the kernels for what we have right now in work that's going on the Hill as we speak to actually try to get some universal coverage. And that then moved me into positions that were political. So I became a political appointee in the Clinton administration, but I had a very strong policy and research background at that point. And one thing I would like to say for the audience here is that I decided early on that I didn't want an academic position, that I wanted to use my policy and my research skills to help shape and move and implement good policy along. And I think, that's a decision that is still open to folks today, both from academia as well as those who decide to work outside of academia, that if you're interested in applied research, there are many opportunities for actually making a difference. And if you fast forward to where I am now, I ended up at Leading Age after I finished my stint in public work, and then went to work for a nonprofit on international longevity issues, to then start an applied research group at Leading Age. And the value for me there, as you talk about the evolution of my work, is that I went from 30,000 feet policy to working in an organization where you are on the ground with providers like OnLock. We have everything from the highest end continuing care retirement community to PACE providers to hospice to lowest income HUD subsidized 202s are in our membership. Think about the natural laboratory that you have as a researcher. So that was my vision for when we started the center here 25 years ago, and it's still going today. We're lean and mean, and we do a lot of collaborative work with others like Bianca. That's how I actually got to meet Bianca. But it really is the opportunity to think about how you do applied research in all of these different venues and how you learn from that to actually make better policy and better practice. At the end of the day, that's the goal.
Yeah, that's so
So that's my
wonderful.
trajectory
Yeah,
in a nutshell.
I feel like, I mean, just these short histories that Robin and Jenny are giving between their own backgrounds, let alone the history of just how aging policy and programs have evolved in America. I feel like this deserves a book just by itself. Probably more hours than what we have in time here, but I think is helpful, hopefully, to the audience is hearing just the different ways in which research kind of pops in and out of your careers and the important ways they play out. And we'll talk a little bit more about that. But Robin, you alluded to also being aware of OnLock and the PACE program. And so I want to turn to Jenny because we had in our conversations about the fact that the two of you have led somewhat parallel lives, sometimes complementary, sometimes on opposing sides. And Jenny, I believe you shared with me in that earlier conversation how you came across Robin. And could you speak a little bit to OnLock and the relationship with the feds and where Robin and your lives have intersected? And could you just tell us a story or two about that?
Oh, sure. But I think one of the things that is to underscore, Robin and I started from very different venues. And so how one's career and opportunities evolve becomes, a set of multiple open doors. So there's no one door in which to start with. And a lot of it depends on context, the political environment, the social environment, the programmatic environment, and what drives us. You can hear the passion in Robin's voice about what's important to her. And so I bring a commitment, a deep commitment from a different door. And yet here we ended up together, which I'll talk about, but it's a way of having impact. And we can have impact that I think actually uses the same words, but we operationalize it differently. And so I came in as early as having some clinical background, but also, frankly, always interested in systems. Things that didn't make sense to me always bugged me. And I was one of these people who poked at things that didn't make sense. And I knew that they were rules or guidelines or programs or research approaches that made sense for a particular set of activities or studies. But I never felt that sometimes these tools were so universal that it applied to everything. And so when you come from the ground level, you see the messiness. Things are gray. They don't fit into buckets oftentimes neatly. And I'll even give an example. When I was the on-the-ground researcher, my goal was to gather data of what is and what could be. And so I came across this home visit with this woman whose blood pressure I took, and I saw that it was like 160 over 110. And so if I were to let the natural process go on, I mean, this woman was at high risk. So I broke protocol, like, as I am wont to do, mainly because I was concerned about her well-being. So she would have fallen neatly into the fact that this is what happens if you have somebody who has this environment and this health condition. And of course, she would be a number. But being clinically driven, I could not ethically allow that to happen when I knew, scientifically, she was at risk. And so I broke protocol. I explained to my boss that I did this, but this was because for me it was unethical not to get this person to some treatment. So I start with a very, again, clinical versus looking and knowing that data is so important to look at trends and directionality. I ended up being on the ground level, and I could not let this go. So that was a bias against the research, really, because I basically contaminated this. But for me, the principle of her well-being was far more important than perhaps what box I was going to fill in. And so, long and short of it, this work ended up proving itself well at the local level. And so often, this is what happens when you get a grant. You get a grant, you perform. You may get good results, you get a paper out of it, you get presentations and all. And so I would say that our founders were, again, pragmatic, and the social worker and dentist. So these combinations are people you don't expect to do this. And so the idea that this cannot die, we've got to do something with it. So we had a researcher whom Robin knows, Rick Zawadsky. And so he brings the PhD research. He did the research on the BART system and the metro systems because they were starting at that time. So data was very important. So you bring in somebody into the team that is not like you, but their knowledge is vital. And we knew that. And our executive director, our founder, was a social worker, realized that was not her bailiwick, but she brought Rick in, and he put the rigor and the ability to do this stuff. Long and short of it, years went on. Got money from the Robert Wood Johnson Foundation to replicate. We found similar outcomes, and with very different populations. These were not ethnic, racial populations. So the principles were really there. And so the ability to test this. And so we did test it in 7 different states as well, with different subpopulations. And so the evidence was there from a month. We have not brought up money yet into our discussion. And so in addition to policy, research, and good care, you have to think about the money. And so that's one thing, to tell you the truth. I think our education historically has not done. We learn systems, but we don't put the ecosystem, that it's policy, it's practice and services, and then the finances. And the finances have to play a part in this from a policy perspective and even a political perspective. So it went to Robin. Robin was our big boss at the federal level, and I knew of her reputation as a researcher, and I had known her before from her work, but I came to her, frankly, as the advocate in this case. And so Robin, being the excellent researcher she was, she plotted out how the research should go, and it amounted, Robin, if you can recall, it was 10 years, and I went, 10 years. I mean, we've been doing this, and never will you find a group of people who are willing to take risks and do this stuff. I said, these are probably some of the most ethical people who are bucking the system now and doing this. And but she had to hold standard. I mean, she's the top researcher here, but this is the approach to do it. So being an advocate role, I thought, well, Robin, I know this is what would be appropriate, but this is going to take 10 years. And as a matter of fact, late 90s, this is like we were in the 80s then, I said, managed care came into being with no research. It was a political policy financial decision, regardless of what the data told you, they needed to cut the money and save on it. And a whole policy came into being. So I said, here you have a group that's really working diligently, not with a randomized controlled trial and things like that. I said, but this is a different way to think about research and applied research. And that was before we had tools that Robin alluded to earlier. That tools evolve, but this was prior to having accepted tools. We had quasi experimental, but that was always kind of like second class. But nevertheless, it was appropriate enough when you look at the ground game. And so the long and the short of it, I said to Robin respectfully, I said, Robin, I know this is what is technically correct, but I'm just going to have to do this differently. And so sure enough, I went political and got bipartisan support, and the other states had bipartisan support. We had information available and data and cost information, which is also frankly very important, as I cited earlier. Cost and quality and access and diverse populations, these mixed in. But I cannot emphasize strongly enough the financial side of this. It moves a big tail. So the long and the short of it is we got the support, we got the appropriate committees politically. So then that's a different body of knowledge, and it's also a different form of a playbook. And so coupled with good research, a playbook of trust over time and credibility led us to a circumstance of passing federal legislation and background politically, just having timing of a setting when both parties were willing to talk to each other.
So I'm hearing this amazing journey of unlock spreading and being cognizant of bringing together data to get this program to expand. So Robin, on your side, what were you seeing as Unlock was growing? And
so I want to say, so here again, we only had two models of any kind of integration in those days. So you had Unlock, which had done some replication work through Robert Wood Johnson and was becoming the program of all-inclusive care for the elderly. That's where the name PACE comes from. We also had the social HMO. That was the other model that actually was built off of the old HMO, the managed care model. That was the old managed care model, a la the Kaisers of the world, that started with a salary-based staff and all of that. So very, very captive managed care that expanded into long-term care. So there were 4 of those SHMO programs. We called them SHMO, that was social HMO in the country. And they were really, so I was the deputy assistant secretary in ASPE, and my group was really responsible for all the aging, long-term care, and disability research and oversight of all the policy work that would come out of CMS, which was then HCFA, and other organizations in HHS, which is why Jenny came to me. And the thing that I loved about PACE, and what I still love about PACE, is not just the capitation and the stat model, but the workforce model of a truly integrated team-based approach where there is empowerment of all the people who are involved to touch every part of folks' lives. So I supported that model, but as Jenny said, from my seat, I had to make sure that the research was good enough, and particularly on the cost side, because it wasn't clear how much, while it saved money, it was also a relatively expensive model to get up to speed and then to operate. And so the challenge, as Jenny said, was we didn't have the same technologies that we have today around our methodologies to actually look at Unlock and PACE replication. there was some quasi-experimental design work that was done. We probably knew we could never do a true randomized controlled trial. But now we have things called pragmatic trials, where you can actually go in and understand that you have to work within the messiness of something like an unlock in order to understand not only outcomes, but how you actually implement something well. And community participatory research, which is the qualitative side that looks at the end user and the family, all of those kinds of methodologies that maybe some of the people on the line are a part of today, weren't really available to us. So I held party line. Basically, I was a political remember. And so I held party line in HHS, and they did what any great provider group is going to do, which is go to the Hill and try to get congressional support. And the only thing that I would say to Jenny these days is that the hardest thing right now of moving pace further is that what was enshrined in the statute was the adult day center, which has become in some places a problem because it is not flexible enough for some areas. And it also doesn't allow us to expand fast beyond the tail of the population that is served by PACE now. I think the PACE program ought to be serving everybody from early intervention all the way to end of life. So how I would conclude this is by saying, in order to be a researcher that's trying to change policy and practice, you have to understand the limits sometimes of what policy is going to give you. And you may have to bring politics and the legislative piece of this into the work that you do. All the time you're sort of manipulating and working with everybody and all the stakeholders that you know to get to the same end game. And at the end of the day, we are now moving forward substantially for PACE and these models that actually do demonstrate good integrated care. So I think the message that I would have is understand the limits. What kind of a provider is going to wait 10 years for research? I've been at leading age now for 25 years. I know there is no provider in our membership that's going to wait 10 years for a randomized controlled trial. So these compromises have to be made, but you also have to understand the barriers and the limitations, and sometimes how to end run them in order to get your advocacy done.
Yeah, no, that's a great point. And as you are all aware, we have lots of researchers in the room and they want their research to matter. And each of you kind of touched on different methods like randomized control trial, probably not realistic, but there are quasi experimental designs that are out there. I guess what kind of tips would you give to our research out there who are actively trying to figure out how to contribute meaningfully to not only evaluating existing programs, but trying to make a change and move it into the policy space? What kind of tips would you give, both in terms of methods that they should probably either be focused on or ways in which they should connect with people? Like, how do they break free of just doing what many of us do, which is the academic work of collecting data, publishing it, trying to tweet it out, hope that someone sees it, and move forward? How do we break out that mold and shake things up in the ways that you both have done?
Well, I'll jump in.
Oh, go ahead, Jenny.
Yes. Well, one of the things that I pride us on in terms of our group, part of it is like there is the core research and the methods and the credibility of that and the acceptability. But one of the things that I always watched and commented on is in my 25 years there, staff retention was superb. So we talk about the direct workforce now and the turnover that happens also in so many settings of either facility driven like long-term care facilities or assisted living or in the home. But the notable thing is that there's severe turnover. And one of the things we kept as our metric, which is not your classic evaluation metric, is to think about retention of staff, because that feeds into quality of care as well as culture and as well as the individual's economic security, because these are not positions oftentimes that pay well. And then from a professional standpoint, if we could tell within a year whether a doctor was going to survive our system, if they could adapt to the fact that there was a team. It wasn't just him or her as captain of the ship, which is where traditional structures are. So you're actually changing things that while you're doing research, you're also changing structural incentives and relationships. And so the relationship that one example I'll give, a team winner was discussing an older member who wouldn't take the medicines that were appropriate and necessary. But we also knew that there's a janitor who happened to have a good relationship with him. So we brought the janitor into the team because that was the most effective person here. Everybody's got the degrees, they've got the license and stuff, but our goal was to see that his well-being was going to move towards steady state. And having an MD coming from Johns Hopkins or somebody like that is not going to be convincing enough. But this janitor had a relationship. And so he was able to develop this relationship, and he was deputized to do this, and regardless of credential, but he had the trusted relationship. And so the fact that you could do this with the workforce and the drivers who would say pick up somebody, they would notice something was awry and they would report it. And the professional would take that report, do something with it, stabilize the person because the person was probably having a medication reaction. Let the driver know, in this case, that his reporting made a difference in this person's life. So there's a whole different set of cultural structures that were designed into this, that the person who we all turn the goalpost toward is the person we're caring for. And yes, the doctor deals with depression, the nurse does, the social worker does. But in this case, the best person to be the messenger was somebody else. And the idea that these professionals could let go and not get so wigged out about their credentials, and see that the best work is done, that was another thing that helped people stay. And then our direct care workers got the same benefits that everybody else did. So the sense of equity was built into the system. People had a retirement system, a 403B retirement system, so that the direct care workers, when they retired, some people stayed for 25, 30 years, they had a retirement kitty for them. So I think you have to start thinking, if you're going to change systems, there are small ecosystems that oftentimes are thought of individually, but you take it holistically. And I'm grateful to say that in my 25 years, we didn't even have a lawsuit that came to bear in a full capitated model, because risk management was built into it. So there are many pieces of system structure that have to be thought of. And that's why we take the research, but it has to be in soil that can thrive.
I love
Yeah,
that.
and I would say Jenny just basically laid out the couple of things that I would say to the researchers as somebody who was trained as a researcher but decided to not go the academic route for some of the reasons that you are raising, Bianca, and that is that I would say NIA has come a long way from 50 years ago in terms of so much acknowledgement now of the pragmatic need for applied work that actually recognizes the real world that has to be studied if you're going to actually be help to change policy and practice in a way that's going to really be useful. But they still need a lot further to go around the implementation science piece of this. And some of my recommendations, and it's fighting a system, particularly when you're in a tenured environment in an academic setting, and you're so focused on peer-reviewed journals and all the things that you were talking about, is to look at different options for funding, either through philanthropic foundations, other mechanisms for getting resources into your studies that allow you to have a lot more latitude for how you set up your methodology and how you study these things. The other thing that Jenny was talking about, I think, which I think is something that everybody needs to think about, is that when you're working in a real world environment, you're actually doing management CQI. So if you don't consider this just as a project with an outcome that you publish in a peer-reviewed journal, but that you are helping the organization to change as you go along with your findings. Now, that's going to contaminate your outcomes ultimately. And so you have to make your compromises. But if they found that the janitor was the real key to a team-based approach with the most trust, and by the way, we have taken that model and we are training janitors in senior housing right now. As we speak, we have a project in Baltimore with 8 affordable senior housing properties where the janitors are all janitors. They are actually now environmental science folks is how they are referred to, but we are training them around aging, dementia, relationship building, and so that they become part of the team with property managers and service coordinators. And it's a pilot that we're doing in Baltimore and surrounding towns in Maryland. But we hope that with that, we will move it to the next phase. So that's the other thing, is learning from other models that have evidence base to then move it into other kinds of things that you're doing. But you have to have the flexibility to be able to do that. And your goals cannot be just around peer-reviewed journals and those kinds of things. If you think about this as an ongoing partnership with the people that you're caring for, the organizations that you're studying, they become partners. Ongoing feedback is essential. Providers want to know what's working and what isn't working. And so when we approach them, will you be part of a study? It's not just about, at the end, we'll have something that we can write up, but it's about, we're going to be feeding that back to you so that you can do on the ground change. And a lot of practice change happens that way. And that then evolves up to policy folks at the local or the state level, because they can see what the barriers are to making this more normative. And in some ways, that's what Jenny did when she went to the Hill. Rick Sawatsky and his team had enough data to go to the Hill and say, we're ready to move on this as a permanent Medicare provider. And they got the legislation to do that. So it's really sort of more of a grassroots approach than it is developing your research from the test tube in the academic setting, because we're dealing with social science here. This is not bench science, right? So it's squishy and it's multifactorial. That's the other thing. We can't expect that we're going to learn. We have to just dismiss this idea that we can parse all these things out. There is nothing in these systems change activities that are not going to be multifactorial. You have to have that kind of design if you're actually going to understand what's working and what isn't working.
So I'm curious, and audience, I certainly want to welcome you to chime in and provide questions in Q&A, but I'm not seeing any, so I'm going to keep going because I'm sure they're listening very intently to what you all have to say. So both of your careers have spanned quite a few different administrations, and I'm going to just turn it to kind of today's environment and hoping maybe we can leave folks with some sense of hope about how the research can keep going, because I think what I'm hearing too is this ongoing thread that work is incremental. It does continue to progress despite ongoing politics. So what kind of advice would you give to our audience about how to think about their research agenda in light of what feels like a politically tumultuous time? What kind of lessons have you learned over the years about where politics and the high level national politics, where that fits in with the everyday day-to-day of the work that you did? Maybe Jenny, do you have any thoughts on that?
Sure. Actually, I would say we were lucky because our work caught the attention of the chief of staff of Senator Robert Dole from Kansas. Uh, and was, of course, a very, very strong Republican, and eventually, he led the Senate. But his chief of staff happened to be a nurse, and Sheila Burke, Robin, and she caught wind of what we did, and so she ended up taking the interest. So it's not the named politician, but understanding the legislative and policy staff they have around them, so that you build relationships over time. You have enough evidence to keep them interested. And then when our shocker was when he decided to run for president, and we thought, oh my gosh, we're in the midst of getting our legislation introduced, and he goes into this role. Of course, he did not get the win for representing his party. And so we lost our power base. And so one of the things I realized I had, though, in California, I had built some relationships up and down the state with again, always a bipartisan. I think, we may have our own identities, but work in a democratic society has to come in this very tortured way. But the ability to make sure that you have contacts and colleagues on both sides of the aisle. And so part of it is building that over time. That doesn't happen just because Dole suddenly lost. I'd have to find somebody. But I knew somebody from before and explained to her what my situation was. She then, in turn, introduced us to Bill Thomas, who was the Republican minority leader of the Ways and Means. And so he took this on and quizzed me. There's an article I have where his chief of staff actually talked about the fact that she was so surprised that he spent an hour and 15 minutes with me because he was somebody who just kind of gave you short shrift, really. But I found out, luck would have it, he knew a lot about hospice. He quizzed me about hospice, and he, had some family members who had gone through that. So people have personal experiences. Every one of us have personal experiences in this space. And if we can depoliticize the factor of what it is we're trying to achieve, and so that you build the tent, and sometimes that tent building takes a while, but you understand what the core things that are important to one party, and the others, and you weave that into your narrative and show that it's woven in, so that it's like everybody got a piece in this, and it wasn't just a win for one party or the other. So I think having a narrative that takes into consideration the policy and political bents of this. When you have a story of long-term care, it's not a political thing, And so our deconstruction, in a way, to highlight the things that are important to them, that it's there, and they can tolerate the other stuff perhaps, but that their big muscle is being addressed in something that is about universality. It's not about a party line in and of itself. So that was something, and that relationship building is over time, not just when you need something. So you stay in touch and build relationships over time. And the fact that I had a backup when I suddenly lost the big card. So I think that helped a ton, that I had colleagues and acquaintances on both sides of the aisle.
That's great. Yeah, Robin, thoughts?
No, I agree with that. I think the relationship building is critical. I mean, I would say both Jenny and I have probably incredible networks over many, many years, and you never know when somebody is going to be somewhere, and always understanding that wherever you are trying to take again, from the research perspective, you have to be in the world of being able to have the relationship around talking about what you have found in a way that people understand. That's another thing. There is a language barrier often If you go to a scientific conference, for example, 3/4 of what you're seeing, a lot of people would have no clue what the heck anybody's talking about. You have to make it user friendly. Every single study that we do here, we have a policy and a practice brief attached to it, 2 pages max. That goes out electronically everywhere. They want to see the study, they can see it. But we're trying to make people understand this, and that goes way beyond the academic language. And that is a skill and knowledge, but it can be learned, and you can also partner around doing that. So I think the right now this bipartisan view has to be here, even in this time of incredible strife that we have. There are people under the scenes at the federal and state and local level, regardless of party, that are interested in what you all are, what everybody is trying to do. It's getting to them and working those relationships and sharing information in a way that people can understand. Translation of research, without that, there's no application. When I look at a funder and they give you $5 for dissemination, and they've just spent $15 million on a randomized trial, but no resources for translation and dissemination, we're losing so much in not being able to turn that into something that can actually make a difference.
That's so true. Now I'm recognizing we're already almost out of our 1 hour period. It's kind of blown by.
We could talk forever.
But I do want to give you each of you a moment to just say what do you hope that people take away from our conversation today? Just, we've had a great conversation. I know I certainly have learned a lot just hearing about your histories, hearing about your personal histories, but also your work histories and the organizations that you have been part of. And I'm sure many here feel the same. But yeah, what would you want to leave our audience today with?
Well, I would just say I know that this award group is focused on workforce writ large in the sector. And I think so just by that very nature, it's applied. You're trying to develop the most important leg of a system. I always argue if you don't have the people to do the work, you don't have a system. And so this is an essential part. So the opportunities there are tremendous. The gaps in our knowledge around this, as Jenny was saying many, many years ago with the Unlock program, that workforce piece, retention, was an essential part of the quality that was actually part of the Unlock success. So how do we think about taking the work that you all do through either the award network or any of the other work that you do and have those relationships to do that kind of translation work and make some changes in terms of the long-term investment that we're going to have in building this workforce that's actually going to help us to produce quality. And that's going to take not only the rigor of the research, but the opportunities, as Jenny said, and as I have tried to do, which is to get our work out there in a way that's actually going to change hearts and minds of folks that can make a difference around this, both domestically and globally as well.
That's great. Jenny, any final parting words?
Yes, I know we're at time. I would underscore what Robin has said. I'd say a theme. There used to be in one of the weekly magazines, news you can use page. And so part of it is doing something that you feel might help the next person who's trying to make change, benefit, and move the work along. It's not that we have to do it ourselves, but in the reality is there are people with different perspectives, different audiences and all who need to be involved. So it's building that community over time so that you have an ecosystem not strictly sticking only to our friends who are in our domain, whether it's in practice or research or education. Because I know there's just the human tendency to hang together, but if you're going to have impact, and the world is a lot bigger and a lot more dimensionality to it, you have to participate in those other dimensions and not stick to our one door that we open for ourselves.
Wonderful pearls of wisdom. And I do want to acknowledge that there were a couple of comments from the audience just saying thank you for such amazing, conversation that happened here today. And again, this is recorded, so I certainly want to encourage people to share this widely with their networks, as I'm sure many people can benefit from it. But thank you, Robin and Jenny, for taking this time. I know your time is incredibly valuable. And so the prep work that kind of went into preparing for this great conversation, which I think could have just happened without any preparation, I'll be honest. But I just appreciate just having that conversation, as I know I've learned a lot, and I know others probably certainly have too. So thank you again for taking the time today. And thank you to everyone in our audience for joining.
We
Thank you
thank
so
you.
much.
Thank
This
you,
was great.
Bianca.
Of course.
Thank you.
Have a
Bye,
wonderful day.
everybody. Bye,
Bye.
Bye all.
Jenny.
Bye
Bye.
all.